Hi, my name is Samantha Olinger, and I did my practicum project on electronic hand hygiene monitoring. Introduction. I chose this project on electronic hand hygiene monitoring because it is close to my heart. My husband is paralyzed from the chest down and spent roughly 6 months in and out of the hospital due to hospital-acquired infections last year. Proper hand hygiene is of utmost importance when it comes to preventing hospital-acquired infections. HAIs not only endanger patient safety, but can also lead to significant complications, including death. These infections cost U.S. hospitals roughly $96 to $147 billion annually and affect roughly 1 in 20 patients. Despite the recommendations from the World Health Organization for proper hand hygiene compliance rates are still considered to be well below the standard threshold, with them being as low as 38%. As shown in Figure 1, these are the recommended 5 hand hygiene moments that should be completed for every interaction with the patient. On average, most mid-sized hospitals have close to 10,000 hand hygiene opportunities every day. It is for these reasons that most hospitals already have in place some sort of policies to actively monitor and promote proper hand hygiene compliance among healthcare workers. On the next slide, electronic hand hygiene. Most hospitals rely on old-fashioned and ineffective methods to observe and control the process, which typically shows that hand hygiene compliance rates are between 30 and 60%. To effectively monitor these rates, hospitals can use the advancements of technologies, with facilities having access to new developments that will ultimately improve hand hygiene. As the use of electronic hand hygiene monitoring systems become more established within healthcare facilities, they will help to establish a new and better standard for patient care. As stated, the best solution for each hospital is going to depend on each setting. This is where the 4 core system functions come into play, with helping to decide which system is going to be best for each hospital. The 4 R's are record, report, remind, and reassure. Record. While all systems typically gather the same information, each type will vary greatly depending on which system is chosen. Report. Capabilities of each system are also going to depend on which style and data that is needed to be collected. Remind. While not every system is going to have this option, it is shown that this is going to be the most effective in changing overall health behavior in hand hygiene compliance. And reassure. It is important to pick a system that will show the dedication that the hospital has to each and every patient's safety. It is during this study that we will take a look at Chesapeake Regional Medical Center's hand hygiene compliance rates within their critical care service line, which include the emergency department, the hospital's 2 intensive care units, and the operating room. On to the next slide, methods. During the duration of the study, 25 physicians have all given their word to participate, as well as the nursing directors, nursing managers, and the frontline nursing staff as well. Along with the typical participants, the environmental services or housekeeping will also be involved. The materials used within the study are going to vary depending on which stage the study is in. During the first month, there will be 8 observers who will go between the 4 units involved. This will give us the opportunity to gather the baseline data. During this period, they will be asked to fill out the hand hygiene observation form, as in Figure 2 in the slide. This will help us analyze any data of the baseline compliance rates. After this initial 30-day observation, we will be testing out 3 different systems within the hospital. Next slide, electronic hand hygiene systems. There will be 3 systems that will be tracked: DebMed, Hillrom, and MedSense. DebMed will be the first of 3 systems that will be tested during the 2 to 4 week trial. DebMed is a wireless communications technology that is built into the soap or alcohol-based hand rub dispensers that will automatically track the usage and send it back to the server within the hospital. The only downside with this system is that the system does not track individual healthcare workers' compliance rate. Rather, it tracks each opportunity that can take place during the day. Hillrom hand hygiene compliance will be the second system to be tested. Hillrom uses a series of sensors that are installed on all hand hygiene dispensers and at the threshold of the patient's room on each unit. The unit uses a badge that will track the hand hygiene upon entry and exit from the room. Therefore, it is capable of tracking individual compliance rates for all staff members who will be participating in the study. MedSense will be the third and hopefully last system to be trialed within the 4 units. MedSense is an electronic hand hygiene compliance monitoring system that will provide a continuous access to compliance information. This system stands out in the fact that it can operate in open cubicles that have multiple beds. This allows for the system to not disrupt any workflow for any of the staff. MedSys works with an electronic device that is worn in the style of a badge to help detect hand hygiene opportunities and compliance rates for each individual user. Each of these will be done in a 2 to 4 week trial period with a survey being filled out by every participant at the end. On to the next slide, results. During the first month, the 8 observers filled out a hand hygiene observation form for all 4 units within the study. The data that was collected to help analyze the baseline hand hygiene compliance rates. Obtaining the baseline compliance rates for these 4 units before the 3 companies come in will allow us to decide which of these systems will potentially work better for the medical center. The first unit observed was the emergency room. There were 64 total observations during this month. They received 100% compliance within the physicians, 75% compliance with certified nursing assistants and physician's assistants. The second unit is ICU 2, intensive care unit. 96 total observations, 100% compliance with physicians, and 92 to 100% compliance with nurses, but a 50 to 60% with food staff or environmental services. The third unit, ICU 4, had 267 observations, and they maintained between a 97.2 and 100% compliance rates for all faculty and staff that were using it. The first of the 3 hand hygiene systems, DemMed, has just finished being trialed. The data is being gathered and put together over the next few weeks. During this time period, the next system, Hillrom, will start coming in to start set up within the 4 hospital units. As with all hospital units, everything is over time and as they are approved. So we are waiting for everything to finish going through. On the next slide, discussion. As the practicum comes to an end, the project will continue to move forward with the next 2 electronic hand hygiene systems, Hillrom and MedSense. As these 2 systems finish their testing phase over the next few months, the participants will each fill out a survey to let us know which system they prefer. Once all 3 electronic hand hygiene systems are finished being tested, the data will be collected, analyzed, and then sent to the Infection Prevention Committee. Once it makes its way to this committee, it will be determined if one of the 3 systems will be best fit for the hospital. If not, more companies will be called in for testing. If one of these 3 systems is deemed the best fit, the Infection Prevention Committee will send their recommendation up through the hospital for approval and then for funding. Electronic hand hygiene monitoring is still considered in its infancy within the healthcare world, thus leaving for future uses of this data to be used in so many ways. Whichever system is chosen, the hospital will be able to track hospital-acquired infections quicker and be able to see which healthcare worker is not complying with proper compliance rates. The goal of this is that whichever system the hospital goes with, they will have a tool in their belt to show the community that electronic hand hygiene monitoring systems will have a positive impact on the healthcare system. They will show the community and other hospitals that these systems will help improve patient safety and hospital cleanliness. I have enjoyed being able to work with this and look forward to finishing off my research with them over the next few months as everything goes. And these are all of my references. Thank you so much.